Welcome back to Pill to Purpose. Today, we re-diving into a medication that many people rely on for a breath of fresh air, Albuterol. If you or someone you know has asthma, you've almost certainly seen one of these little inhalers. It's a fast-acting lifesaver that can help you breathe easier within just a few minutes. So stick around as we break down what albuterol is, how it works, its common uses, benefits, and of course, the important safety information you need to know. First things first, what exactly is albuterol? In simple terms, albuterol is a type of medication known as a bronchodilator. The word itself gives you a clue. Broncho refers to the airways in your lungs, and dilator means it opens them up. It's most commonly used as a rescue medication. Think of it as the first responder for your lungs when you're having trouble breathing. When your airways tighten up, making it hard to get enough air, albuterol comes to the rescue. It works by quickly relaxing the muscles around your airways, allowing them to widen and making it much easier to breathe. While it's most famous in its inhaler form, which is super portable and easy to use on the go, albuterol also comes in other forms. It can be a liquid solution used in a nebulizer, which turns the medicine into a fine mist you breathe in through a mask or mouthpiece. In some cases, it can also be prescribed as tablets or even a syrup. But for fast relief, the inhaler is definitely the most common and effective option. So, how does this tiny device deliver such quick relief? The science behind it is pretty cool. When you take a puff from your albuterol inhaler, the medication travels directly into your lungs. There, it targets specific receptors called beta-2 adrenergic receptors. These receptors are found on the smooth muscle cells that line your airways. When albuterol binds to these receptors, it triggers a chain reaction that causes these muscles to relax and stop constricting. This has several immediate effects. First, it opens up your narrowed airways, creating more space for air to flow through. This directly relieves that feeling of tightness in your chest that can be so scary. As airflow improves, that awful shortness of breath or wheezing sound starts to fade away. The best part is how quickly this all happens. Most people start to feel the effects of albuterol within just 3 to 5 minutes, which is why it's called a rescue inhaler. It's designed for those urgent moments when you need to breathe better right now. Now, let's talk about the specific situations where a doctor might prescribe albuterol. Its primary job is to provide quick relief from sudden breathing problems. The most well-known use is for asthma attacks. During an attack, the airways become inflamed and constricted, and albuterol is often the first line of defense to open them back up. Another major use is for chronic obstructive pulmonary disease, or COPD. People with COPD often experience flare-ups or exacerbations, where their breathing suddenly gets worse, and albuterol can provide rapid relief during these episodes. It's also incredibly useful for something called exercise-induced bronchospasm. This is when physical activity triggers your airways to narrow, causing coughing, wheezing, and shortness of breath. Taking a puff of albuterol about 15 to 30 minutes before you start exercising can help prevent these symptoms from happening in the first place, allowing you to stay active. Beyond these, it's used for any sudden breathing difficulties. Whether they're caused by an allergic reaction or exposure to irritants like smoke or strong fumes. It's important to remember that albuterol is not a long-term control medication. It doesn't treat the underlying inflammation that causes asthma. Instead, it's there for immediate, on-the-spot relief. If you find yourself needing your rescue inhaler frequently, it's a sign that your underlying condition isn't well controlled, and you should talk to your doctor about your long-term treatment plan. The benefits of albuterol are clear, especially for those who rely on it. The number one advantage is its speed. When you can't breathe, every second counts, and albuterol works incredibly fast to restore normal breathing. This rapid action not only provides physical relief, but also immense psychological relief, reducing the panic that can come with an asthma attack. As we mentioned, it's also a fantastic tool for prevention, particularly for exercise-induced asthma. This allows people to lead active, healthy lives without fear of their breathing holding them back. The portability of the inhaler is another huge plus. It's small, lightweight, and can be easily carried in a pocket, purse, or backpack. This means relief is always within reach, whether you're at school, work, or traveling. The immediate relief it provides from wheezing, coughing, and chest tightness can be life-changing, turning a potentially dangerous situation into a manageable one. Using an inhaler is also a relatively simple process once you learn the proper technique, making it accessible for both adults and children. Of course, like any medication, albuterol comes with potential side effects. The good news is that for most people, the side effects are mild and temporary. They happen because the medication can sometimes affect other parts of the body, not just the lungs. One of the most common side effects is a feeling of nervousness or shakiness, sometimes described as tremors, especially in the hands. You might also notice your heart beating a little faster than usual, a condition known as tachycardia. Some people experience a headache after using their inhaler. Others might get a dry mouth or some irritation in their throat, which can sometimes lead to a cough. These effects usually go away within a short period, from a few minutes to a few hours, as the medication wears off. If you do experience these, it's usually not a cause for alarm, but it's always good to be aware of them. While most side effects are mild, there are some rare but serious ones that you should be aware of. If you experience any of these, it's crucial to seek medical help right away. These include severe chest pain or an irregular heartbeat, which could indicate the medication is putting too much strain on your heart. Severe dizziness or feeling like you might faint is another red flag. Most importantly, if your breathing does not improve after using albuterol, or if it actually gets worse, This is a medical emergency. This could be a sign of a very severe asthma attack that requires more intensive treatment. Worsening shortness of breath after using your rescue inhaler is a paradoxical reaction and needs immediate attention. Remember, albuterol is supposed to help you breathe better. If it's not working or making things worse, don't hesitate to call for emergency help. These serious side effects are not common, but knowing what to watch for is a key part of using this medication safely. So, who should be cautious when using albuterol? While it's a very common and generally safe medication, it's not for everyone, and certain medical conditions require extra care. It's essential to have an open conversation with your doctor about your full medical history before starting albuterol. For example, if you have any heart problems, like coronary artery disease, high blood pressure, or a history of arrhythmias, your doctor needs to know. Albuterol can increase your heart rate and blood pressure, so it needs to be used cautiously. People with an overactive thyroid or hyperthyroidism may also be more sensitive to the stimulant effects of albuterol. If you have diabetes, it's good to know that albuterol can sometimes increase blood sugar levels, so you might need to monitor your glucose more closely. Lastly, if you have a history of seizure disorders, it's another important piece of information to share with your healthcare provider. Also, be sure to tell your doctor about all other medications you're taking, especially other asthma medications. Combining different inhalers without medical guidance can sometimes lead to problems, so a complete picture of your health is always the safest approach. Finally, let us wrap up with some crucial safety tips to ensure you're getting the most out of your albuterol inhaler while staying safe. First and foremost, if your doctor has prescribed a rescue inhaler, carry it with you at all times. You never know when you might need it. An asthma attack can happen unexpectedly. Second, don't overuse it. This is a big one. If you find yourself needing your albuterol inhaler more than 2 days a week, it's a clear signal that your asthma is not well controlled. Your rescue inhaler is for emergencies, not for daily management. Talk to your doctor. You likely need to adjust your long-term controller medication. Third technique is everything. If you're not using your inhaler correctly, you're not getting the full dose of medicine into your lungs. Ask your doctor or pharmacist to show you the proper technique. They might also recommend a spacer, which is a device that attaches to your inhaler and makes it easier to get the medication deep into your lungs. It's especially helpful for children and older adults. Lastly, keep track of your doses. Many modern inhalers have a dose counter, but if yours doesn't, you'll need to track how many puffs you've used so you know when it's time to get a refill. You don't want to be caught in an emergency with an empty inhaler. In summary, albuterol is a truly life-saving medication when used correctly. It's fast, effective, and reliable for providing immediate relief from sudden breathing problems. It empowers people with asthma and COPD to live more freely and with peace of mind, knowing that help is just a puff away. Understanding how it works and how to use it safely is key to managing your respiratory health effectively. If you found this video helpful and want to learn more about the medicines that shape our lives, please give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe to Pill to Purpose. Thanks for watching, and we'll see you in the next video.